how's cataract surgery actually done? Hello friends, Dr. Boparai here. Cataracts lead to what's called reversible vision loss. That is, once the cataract surgery is done, you should be able to gain back the vision you've lost because of the cataracts. Now, your cataract forms inside your natural lens, and this natural lens, you're born with it, you've had it for your entire life, it helps you see. And as we get older, this natural lens, which previously was clear and now has become cloudy, turns into your cataract. That's just a natural process of aging. Your cataract prevents light from entering the eye, and in doing so, it prevents you from being able to focus and seeing clearly. The goal of cataract surgery is to remove the cataract and insert a new lens called an intraocular lens that restores vision. So what does that look like for the patient? Now, the cataract is sitting right behind the structure called the iris. At the time of cataract surgery, we want to dilate the iris so that it gets nice and big so that we're able to visualize the cataract that's sitting right behind it. Now, the cataract sits in a structure called the capsular bag that holds the cataract in place. And the goal of cataract surgery is to take the cataract out from the capsular bag and put in a new lens inside that bag, exactly in the same location that your original cataract was in. That's the place that your new lens is going to stay, and that new lens is going to help you focus light and help you see. I'm a cataract surgeon by training, and I love making content on eye health and wellness and cataract surgery so that patients feel informed and comfortable. Hopefully this explains how cataract surgery is done. Now, each surgeon has their own preference, so be sure to discuss with your cataract surgeon. And if you like this content, be sure to subscribe for more videos like this in the future.